Welcome back to the Clinic Minute. I'm Dr. Tara Brown, and the November Clinic Minute is about colds, flu, and antibiotic awareness. If you haven't yet, now is the time to vaccinate yourself for influenza, which is the flu. The flu changes seasonally, and so too does the flu vaccine. Had I not become a doctor, I'm not sure I would completely understand the importance of the flu shot. So there's certainly no judgment if you have never taken the time to get one. But education is power, and now you can protect yourself too. It's not 100% fail-safe, but should you get the flu, the vaccine may offer some protection to you. We know young, healthy people succumb and die of influenza every year, so please take the time to educate yourself and get the vaccine. When we talk about having a cold, that is generally a layman's term for a viral illness. Viruses generally last less than 14 days. The initial days can be the worst, and in some cases, the residual cough can last weeks. It can be hard to distinguish between a viral illness and a bacterial infection, so sometimes we need a clinician's help. We can check out your ears, throat, chest, and lymph nodes. We can decide if we need to swab for influenza, COVID, RSV, or streptococcal pharyngitis, aka strep throat, as well as consider chest x-rays. These are just a few examples of the common tests we use in the outpatient setting to help us determine whether antibiotics are indicated. You will hear me say that my job is to find the source of the infection. For example, if your sore throat is negative for strep on the strep swab, I may find clinically that you do not likely have a bacterial infection and we should treat symptoms. For a viral pharyngitis, I would suggest things like honey, warm saltwater gargles, lozenges, and over-the-counter numbing throat agents. I will also suggest over-the-counter agents to help dry up drainage in the throat because throat drainage can really hurt. Often we use prednisone or steroids to help dry up the drainage. Those are prescription agents, and we must be judicious with their use. Many times we decide a patient has a viral infection and they wait 10 to 14 days only to come back and worse. Unfortunately, a viral infection sets up the perfect environment for a bacterial infection to take hold. One of the biggest pet peeves I have as a physician is when a patient has viral symptoms for a day or two and comes in to nip it in the bud. We want quick fixes and think if we get on an antibiotic quickly, we will get better faster. In some of these cases, by the time a person finishes their round of antibiotics, the viral illness is winding down anyway. Unfortunately, a virus has to run its natural course, and we should allow our body to fight the infection. We definitely can rely on some over-the-counter agents to help with our symptoms. I like to boost my vitamin C intake during the winter months to support my immune system. Vitamin C is water soluble, so I know the extra vitamin C is safely excreted in the urine. You may ask what the harm is in treating with an antibiotic just in case. There can be really serious consequences to using antibiotics. One is developing a horrible rash called Stevens-Johnson's rash, which is rare but serious. Another one that we don't completely understand is what antibiotics do to our gut flora. Diarrhea or a C. diff infection are demonstrable of what they can do to our gut. And then you have the common rashes. Many viruses cause rash as part of the normal part of their presentation, but if we simultaneously start an antibiotic, we may assume we have an allergy to the medicine. There are a bunch of other potential side effects to antibiotics that your provider will counsel you on when you receive the prescription. I usually try to have the over-the-counter medication on hand to treat my cold symptoms. I hope this has helped you think about how you can prepare for cold and flu season.